Ugh, that could not have felt good. Yes, that's right, guys. Today we are talking Civil War medicine. Now, this episode is not for the weak or faint of heart, but follow along with me and I'll show you exactly what you need to do and what information you need to have in order to successfully complete today's lesson. As always, guys, you're going to want to go to your name, click on your name, and then go to class notes. And you will see when you click on Civil War medicine, this is what it will look like. Now, as you can see, my Bitmoji is looking a little under the weather because this is not the most pleasant of lessons, but this is very important because in the Civil War, we are able to make some pretty big breakthroughs in terms of medical treatment and medical conditions. Now, some questions to consider in this section. Number one, what was medicine and medical treatment like during the American Civil War? And two, what effect did this medicine and medical treatment have on a Civil War soldier? Now, you'll see that Civil War medicine starts off pretty outdated, pretty archaic, it's pretty brutal. But they are able, by the end of the war, to make some strides and to make some improvements on medicine. Now, here you have a picture of a military field hospital. So if you were a soldier and you were injured in a battle, more than likely this is where they would take you. Now, at the beginning of the war, military field hospitals were dirty, they were unsanitary, they were places where infections and diseases would spread, and so they come to be known as grim clusters, just these places where you would never want to go. And oftentimes during a battle, armies would take over churches, they would take over schools, they would take over universities, they would take over houses, and basically convert whatever structure they could find into a field hospital. Sometimes they would even use barns, and you can imagine how unsanitary that is. As we scroll down, you can see this is an example of an Civil War ambulance, of all things. So you've got your poor soldier here, you've got a poor soldier here on the stretchers being loaded into a horse-drawn ambulance to be taken away from the battlefield and somewhere where they can hopefully receive some life-saving treatment. Now, as you guys scroll down through this section, I do have a video here that I would like you to watch. It's on Civil War medicine. It's about 4 or 5 minutes long. And I do have a warning here. It does contain some images of Civil War injuries. So if you are somebody that is squeamish and you're thinking to yourself, Mr. Cameron, this is going to make me sick, then don't watch it. All right, but if you're one of these people that wants to know more about Civil War medicine and to see what the Civil War was really like, then I would encourage you to watch that. All right, and then you also have a picture here of a later Civil War hospital. So Civil War hospitals do make some advancements. They do become cleaner as the war goes on, but it takes time for them to figure it out. So I want you to go ahead and read through these paragraphs here. They're going to talk to you about some of the diseases that you might see in a Civil War camp. You're going to see some of the surgeries that doctors would be required to perform, and some of the complications and some of the things that really cause soldiers to die outside of the battlefield. So if you were a soldier in the Civil War, your chances of dying on the battlefield were nothing compared to your chances of dying after a battle. Disease and infection were the biggest killers, far more than actually dying on the battlefield, which is something that I think, tend to not fully understand. We think of the Civil War, we think, oh, soldiers are going to die in battle, when in reality, disease and infection were the biggest killers. So go ahead and read through that. Scroll down, and then here are 2 definitions that you need to know before moving on in the section here. The first one is amputation, and amputation, as we will see, is the most common Civil War surgery that was performed, and that is the act of surgically removing a limb, an arm or a leg. And then the other definition I want you to know is prosthetic. A prosthetic is an artificial body part, it's fake, like a fake arm or a fake leg. So battlefield surgeries were very, very dangerous. And the most common battlefield surgery that doctors and surgeons would perform were amputations. And the reason for that is because of the ammo, the type of bullet that both sides were using in the Civil War. They were called mini balls, and they really weren't mini. They were actually pretty big, and they were lead. And when they hit somebody, if it was in the arm or if it was in the leg, it would flatten out. So just think about the lead in your pencil. but this bullet was traveling at pretty fast rates, and when it entered a soldier's body, that bullet would flatten out. It would cause the bone to shatter, and then those bone fragments would go throughout the poor soldier that was hit. So if an arm or a leg was hit, oftentimes to save that soldier, a surgeon would just amputate the limb. Now, that doesn't necessarily guarantee that their life will be saved because, as I said, infection would often set in afterwards because these doctors at the time did not fully understand how diseases spread. Nowadays, especially in the time period that we're living in, we stress washing your hands and we stress using hand sanitizer and things like that. But doctors in the 1860s did not fully understand how diseases spread. They thought it was through bad air. So it was not uncommon to see a Civil War surgeon use a saw to take off an arm or a leg and just simply wipe the blood off and then move on to the next patient. So as gross as that sounds, and it is very gross, that was the reality in the Civil War. You would have doctors that would just use the same saw to remove the limb of 30, 40, 50 soldiers and never sterilize it. So you can only imagine how much disease would spread. So go ahead and read through this on battlefield surgery, and then there is a short video on amputations in the Civil War. Again, if you're one of these people that is squeamish and you don't want to watch it, it is not required. But if you don't mind that sort of thing, and you want to learn more about Civil War medicine, then I would encourage you to watch it. Once you're done with all that, go ahead and answer these two questions, which are the same two questions that we started this section off with. What was medicine and medical treatment like during the American Civil War? And what effect did this medicine and medical treatment have on a Civil War soldier? I know some of this stuff is disgusting. I know that it's gross. I know that you're hopefully sitting there thinking, thank goodness we have the types of hospitals and doctors that we have today. Well, that medical advancement and all that medical knowledge has to start somewhere. And so if you think back to the 1860s and the Civil War, these soldiers really did not have the best treatment. They did not have the best medical knowledge. They did not have the best doctors. And this is where they have to learn and they make mistakes. And unfortunately, many people died because of those outdated techniques. But hopefully you guys learned something from this video. As gross as it was, as terrible as Civil War medicine was, they did make some advancements throughout the war, and those advancements, of course, have to lead somewhere, and they eventually led up to the year that we're living in now and the time period that we're living in now. And, you have sanitary hospitals, you have nurses and doctors that actually wash their hands and understand how bacteria is spread. But this is where it starts, and unfortunately, many people died because they just simply did not know. So hopefully you guys learned something from this. Make sure that you answer those questions at the bottom. Make sure if you can, watch the videos and do all the readings, and then we will talk about this more as we progress in our Civil War chapter. But if you have any questions, as always, reach out to me, and I look forward to seeing you guys in class or online in the days and weeks ahead. All right, guys. Thanks.